Down syndrome, second chapter.
Having a child with Down syndrome is much like having any child. Children with Down syndrome are just like any other child and deserve support from their family. But Down syndrome will affect everyone in your family: parents, siblings, grandparents, extended family. I'm encouraging you to know a bit about Down syndrome so that you will be prepared if something like that happens.
My name is Eldina Rastić. Let's learn something new about Down syndrome.
According to Down Syndrome Victoria, an organization that has offered support to people with Down syndrome and their families since the 1970s, it is important that the child's siblings be adequately prepared and informed if their new brother or sister has been diagnosed with Down syndrome. The organization acknowledges that parents may be worried that their child may not be accepting of a sibling with special needs, but in reality children are often able to understand that others may be different, but no less worthy of love and respect than anyone else is. If a child develops a positive relationship with their sibling, those outside the family are more likely to treat the child with Down syndrome with more respect. This is because children look to one another when arriving at their judgments about others. Kids look to their parents when forming their attitudes about others and the world around them. This means that if their parents take a positive attitude towards their new sibling, they are likely to assume that the arrival of their new sister or brother is a joyous occasion. If their parents emphasize the newborn's positive traits and particular abilities, their siblings are more likely to treat them as equals, respecting the fact that they have particular needs and do not behave in the same manner as most other children. It is likely that the relationship between siblings within a family will run into problems from time to time. This needn't be a cause for great concern. In fact, all siblings will argue at least occasionally. At the same time, a child going through adolescence may experience their siblings' disability as an inconvenience or even an embarrassment. They may have wanted to support their sibling for many years. They may feel a considerable amount of peer pressure in adolescence and as a result change their behavior. This is normally a phase that passes within a few years. It is more often the case that the neurotypical sibling will feel highly protective of their brother or sister and will offer them help whenever possible. Babies with Down syndrome can be breastfed from birth. However, they may find it hard to support their own weight and suckle successfully if they have low muscle tone. This is because the muscles in their mouth and throat may develop at a slower rate compared with typical children. Some will show a strong preference for smooth foods and will only be interested in a few flavors. They should be encouraged to chew their food because this is a good basis for later speech and language development. Sometimes it may be necessary to seek assistance from a speech and language therapist. They can help a young child build up the muscles required for successful feeding. The baby's skin should be gently moisturized every day using a cream suitable for sensitive skin. Baby massage using special baby massage oil can also be a good and is also relaxing. A baby with Down syndrome may become noticeably hot or cold within minutes. It is a good idea to dress them in a layer that can be easily removed or added. A room thermometer will help parents keep the nursery at the right temperature and guide them in adjusting the bedding as appropriate. It is common for a child with Down syndrome to exhibit restless sleep. Sometimes this may be because they are experiencing physical discomfort that prevents them relaxing. These problems are sometimes seen in typical children, but they are more likely to affect those with Down syndrome. In addition, all children can be reluctant to go to sleep. They may find staying in bed to be boring and their sleep cycle may be erratic, particularly for the first few weeks following birth. A few children suffer from sleep apnea. The child may stop breathing for brief periods during night. If you ever see these starts, it is very important for you to seek a medical help. Parents need to watch for signs that their child might be developing a problem that requires medical intervention. Children with Down syndrome need more frequent checkups than neurotypical children. It is common for people with Down syndrome to have an auditory impairment. This is typically temporary, but on occasion can result in a permanent loss of hearing. The most frequent cause of temporary hearing loss is glue ear. The full medical term is otitis media with effusion or OME. Glue ear refers to an abnormal buildup of fluid in the middle part of the ear. It is uncommon for typically developing children to develop this problem, with 80% of all children having experienced at least one episode by the age of 10. However, it is more common in those with Down syndrome. If a child suffers from repeated episodes of glue ear, they may be referred to an ear, nose, and throat specialist. Requiring glue ear may be caused by abnormalities in the structure of the tube that links the back of the throat to the middle ear. This tube is known as the Eustachian tube. A significant proportion of people with Down syndrome will have visual impairments and will need to wear glasses. There are numerous problems that are often seen in this population. Short-sightedness and long-sightedness cause distant and nearby objects to look blurred respectively. Also, cataracts and glaucoma are problems to these children. Approximately 50% of individuals with Down syndrome are born with a heart defect. Heart defects are not in themselves rare. Around 1% of all babies born have some kind of congenital heart disease. Along with Down syndrome, other risk factors include maternal infections and poorly controlled diabetes. Symptoms include sweating, tiredness, rapid heartbeat, and the bluing to the skin. However, the effects of congenital heart disease can range from severe to relatively mild. Some cases may escape detection altogether until later life. However, because heart defects are so common in people with Down syndrome, their hearts are checked as early as possible. There are many manifestations of congenital heart disease, but the most common version, seen in Down syndrome, is known as a septal defect, also known as a hole in the heart. This kind of defect manifests itself as a hole in one of the walls that lie between the four chambers of the heart. It may be necessary for a baby to have a surgery to correct this defect, which can be worrying for their parents. However, the outcome is usually good. The child will require ongoing monitoring over time because people with congenital heart problems may develop complications such as the trouble with heart rhythm and problems with the walls within the heart. Approximately 10% of people with Down syndrome have abnormal thyroid gland function. Specifically, most have underactive thyroid glands, which means that their metabolism is abnormally slow. The effects, if it is untreated, include poor concentration, weight gain, and a lack of energy. Fortunately, it can be detected and treated early. Blood tests need to be repeated on a regular basis because thyroid problems may only appear later in life. Medication must be used to control hypothyroidism. Because Down syndrome child is at increased risk of infection due to their underactive immune system, they may also be given flu shots. This is because they are more likely to develop infections as a result of illnesses that most other children can overcome. For example, if a person with Down syndrome catches flu, they are at elevated risk of pneumonia, which can lead to death. A lot of people with Down syndrome suffer from chronic gastrointestinal disturbance. Irritable bowel syndrome is often seen in this population. Symptoms include constipation, diarrhea, and indigestion. However, some individuals suffer from more serious problems, some of which are present from birth. For example, some babies are born with an imperforate anus and have no discernible anal opening. Surgery is required to correct this defect. Small bowel obstruction also warrants early medical intervention. Otherwise, an infant will fail to absorb sufficient nutrition and also experience pain. Reflux, a term used to describe an instance of a baby bringing up milk after or during feeding, is common. Parents should notify their child's doctor if this is ongoing or severe, as it could prevent their child receiving adequate nutrition.
Although there is an increasing trend in the general population, those with Down syndrome are more likely to reach high body weights. It is not that everybody with Down syndrome will gain weight, but it is sensible to implement weight control strategies from a young age. Aside from hypothyroidism, one key cause in Down syndrome may be abnormalities in production of leptin, also known as the hunger hormone. This may trigger some individuals to consume too much food. Finally, there may be behavioral factors that increase body weight, such as a reluctance to take part in exercise or strong impulses to eat food that is pleasurable to consume but offers little nutritional value. People with Down syndrome are at high risk of depression. Typical symptoms include the following: loss of interest in activities previously enjoyed, prolonged feeling of emptiness or sadness, changes in appetite and weight, and preoccupation with some bad thoughts. To receive a diagnosis of depression, an individual must experience these symptoms through the day, most days, for a minimum of 2 weeks. Parents and other people involved in an individual's care should look out for signs of a shift in mood, including self-injurious behaviors, reluctance to communicate, an increase in compulsions or obsessions, and physical symptoms such as itches and pains that seem to have no organic cause. An individual may show evidence that they are beginning to adopt a negative view of themselves and the world, which is also consistent with depression. Diagnosing depression in those with Down syndrome can be complicated by the fact that some individuals struggle to communicate how they have been feeling and how their feelings have changed over time. Blood tests should be taken and used to rule out underlying causes of low mood, such as hypothyroidism. However, healthcare professionals are increasingly recognizing that depression is a social phenomenon as well as an illness. In the case of Down syndrome, an individual may feel as though they have little control over their lives, which in turn can give rise to feelings of helplessness. Sometimes parents and friends of people with learning disabilities may underestimate their capacities and step in too quickly to make decisions on their behalf. This can leave the individual feeling disempowered. To help someone overcome their depression, it may be necessary to help them build supportive networks that can add a sense of purpose and control to their life.